Hi. Hello, everyone. I hope everyone is doing amazing today. Today is Monday, beginning of a very good week for everyone, I hope. Today, I was thinking because I see so many cases of dry eyes, like almost on a daily basis. I see dry eye patients right and left, and I'm sure you guys can relate to it because a lot of patients over the internet, on my blog, on my public page on Facebook, as well as patients in the exam rooms, keep asking me the same question repeatedly. If you think about the most commonly seen eye condition or eye disease, probably across the globe in ophthalmology slash optometry slash medical optometry practice would be dry eyes. That would be the number one disease or patients come in for that kind of a symptom. So talking about dry eyes, first you need to know where the dry eye is coming from. So there's the cornea, which makes the tears, and there are the lacrimal glands that obviously make the tears, and then they keep the cornea lubricated. So that's where the dryness appears in most of the cases. If the tear film is decreased, you will suffer from dry eyes, and then it becomes acute dry eyes that leads to chronic dry eyes. There's also another part, another anatomy of the human eye, which is known as the eyelid. And if that has meibomian glands, obviously under the lid there are meibomian glands that are not functioning well, which are clogged over the years. These meibomian glands are supposed to produce oils, like oily secretions, okay? And if that secretion is not being produced enough, that means that the tear film is going to be evaporated, because oils prevent water from evaporating, right? So that's why oil and water never merge together. So that's why if the meibomian glands are not functioning, which is known as MGD or meibomian gland dysfunction, the tears are going to evaporate from the cornea, and that's going to lead to chronic dry eyes also. So we have to treat the lid problem, we have to treat the cornea problem, and then I'm going to talk about the different treatment plans. But let's just discuss the common causes of dry eyes and what the symptoms are and what the presentation is. So mostly we will see whether they are younger patients or older patients, they will come in complaining of decrease in vision. They will have fluctuation in vision even during the exam. During the refraction, my scribes, my technicians will come and say, you know what, doc, the prescription was just going back and forth, and there was so much of fluctuation in the vision during the phoropter exam, which is checking their vision in the exam room. And I would tell them, well, just put in a dry eye treatment, like do some dry eye drop in the exam room and recheck their vision and recheck their refraction. 99% of the times it gets better, because again, there's some lubrication on the cornea and the patient starts seeing better. So that is another thing that we have to remember. If there's fluctuation in vision, it's definitely most likely related to dry eyes. Some of the other things you have to remember are some of the diseases that can cause dry eyes, especially in the elderly population. There could be autoimmune diseases that can cause dry eyes. If the patient has hyperthyroidism or hypothyroidism, they can cause dry eyes. Autoimmune diseases such as systemic lupus erythematosus, SLE, lupus, they can cause dry eyes. There are certain drugs that can cause dry eyes also. For instance, if the patients are on antihypertensives, that's majority of our patients, right? Or if they are taking even antidepressants, they're notorious for causing dry eyes. So remember that as well. What are the other things that we need to remember? Well, LASIK-associated dry eye. If you have a refractive surgery done, such as LASIK, you can get dry eyes as well. And that's chronic dry eyes, which is known as LASIK-associated dry eyes. All of these conditions are treatable, so we'll talk about that in just a moment. What else can cause dry eyes? Well, computer eye strain. That's the biggest thing in America right now, in corporate America, especially including us doctors, also physicians, sitting on the computer. Pretty much all our records are electronic medical records, so we sit on the computer for hours throughout the day. And what happens is, when you're working on the computer, you tend to forget to blink, and when you forget to blink, your eyes get drier, because every time you blink, and you do it right now as you're watching me, just do it, blink, and you'll feel the eyes getting more lubricated, because from the compression of the lids, there are glands that are forced to produce even more tears, and therefore the meibomian gets secreted more, so that therefore the cornea becomes more lubricated, and therefore it helps with the dryness. So blinking, making a conscious effort to blink. And then there's a 20/20 rule that I tell my patients for corporate America, especially the ones who are working on the computer. I get lawyers, I get engineers who are working on the computers, engineers crunching up numbers, CPAs, especially lawyers, and very analytical patients, I would say, like engineers, and they would say, well, you know what, we get dry eyes, we're working on the computer all day. What do I suggest for them? Well, it's a 20/20 rule. You work on the computer for 20 minutes, okay? Then you look away from the screen, 20 feet away, like roughly, you know, something, focus on a target far away. Right now I'm looking through the windows, looking at the trees. Look 30 feet away and blink, obviously, for 20 seconds, okay? So 20 minutes work on the computer, take a break, look 20 feet away, blink for 20 seconds, and then come back and work on the computer screen. So that's very, very effective, because every time you blink, like I said, there are more secretion of the tears, and more squeezing effect makes more of the meibomian gland secretion. Okay, so those were the basic things about the main causes of the dry eyes. I had a little cheat sheet today because dry eyes is a vast topic. It's a big, big topic. So we talked about that. And then, yeah, contact lens associated dry eyes also. So you see patients who come in and they say, well, you know what, I have dry eyes, and then I started wearing contacts. Can you give me something that helps? Well, I always tell them, let's be honest, it's a foreign body, right? Contact lens is a foreign body sitting in your eyes. It's going to cause some dryness also. So then there's a different kind of a treatment I recommend for contact lens associated dry eyes, but it's going to cause some dryness. So, and then in this day and age, we have very good contact lenses that really do help with the dryness as well. But again, that could be one of the possibility. I was just thinking rosacea, that was another thing that I forgot to tell you. Rosacea can cause dry eyes as well. Blepharitis, you know, that crusting in the eyelashes, they can go inside the eye and they can cause dry eyes also. So that's dry eyes. How do I see it? Well, I tell one of my technicians or the nurses or scribes in the room to put a fluorescein strip, which is the yellow strip that goes on the cornea, and I can see the pattern. I can see the tear breakup time, if it's less or if it's normal. And I can see the staining pattern. Sometimes I also see SPK, which is superficial punctate keratitis, on their corneas, and that's an inflammation. Now that is treated differently. That's not just treated with dry eye treatment drops or over-the-counter drops. Rather, it's treated with a corticosteroid drop, which is Predforte 1%, or known as prednisolone acetate 1%. You have to shake the bottle well, and usually I do a tapering schedule for corticosteroids, like maybe 4 times a day for 2 weeks, and 2 times a day for 1 week, and final week once a day. And I see them back in about 2 weeks. But again, that's a Predforte, that's a corticosteroid, and everyone's SPK, superficial punctate keratitis, or inflammation is a little bit different. So we can talk about that some other time. The basic treatment for dry eyes, once I assess that it's dry eyes, you know, I know for sure it's dry eyes, I usually put them on over-the-counter medicines or drops first, and then I do a treatment, like a prescription. And if that doesn't work, then I do other remedies, and I'll tell you about that. The first treatment that I do over the counter is either Sustain artificial tears that you can readily get from the over the counter, but just don't go to the pharmacy like CVS, Walgreens, or wherever, and just randomly start picking drops from the shelf over the counter, because some of them are like terrible. I don't want to name some terrible ones, probably for you know, some reasons, I guess, medical legal reasons, but in the exam room I tell my patients which ones are not good. But the ones that are really good, I can tell you, are Sustain artificial tears. There's a Sustain Complete, that's very good. I do recommend preservative free most of the times, because I don't like a lot of preservatives in these kind of drops. Then there's another one called Refresh Optive Advanced. That's a good one that has no preservatives. That's a good one. And now I'm going to tell you a little bit about what we have in our clinic. And this is something amazing that Dr. Lahi has come up with. This is the dry eye kit we give to our patients, as you can see, which has our name, Lahi Total Eye Care, and all the information. So this is the kit we do recommend, and it's like so good. It has been clinically proven. It has been selected, handpicked by Dr. Lahi. He's the owner of this practice, and I'm going to show you one by one what comes in this like little bag. So first of all, there is these cotton rounds that come in the bag, and they're not for makeup removal, okay? That's the first thing that came to my mind. No, they're not for makeup removal. They're specifically designed for the eyes. So that's there. I'll just go through the details of everything in a little bit. Then there's these iodine capsules. Why do we add that? I'll tell you in a little bit. Then we have this Oasis tears. It's the artificial tears that comes in this bag, similar to Sustain and, you know, Refresh. Then we have this supplement that comes in it, which is known as Thera Tears. And it is therapy for your eyes, eye nutrition, 1,200 milligrams of omega-3 fatty acid supplement. It promotes healthy tears. So I'll talk about that. It's a big bottle that comes in there. Then it comes with this eye mask. And it's a gel eye mask. It has these little beads in it also. It's very, very effective. It has this strap on the back, and I'll talk about that in just a second. And then we have this gel spray also, which is known as OcuSoft gel spray. So now let's talk about these, and then we'll put everything back in this bag. So this is the bag we provide to our patients, and it's very important, it's very convenient, it's very, very easy for them to just get this bag, take it home, and start using all the products, because that way they do not have to go crazy going to CVS, Walgreens, Walmart, or wherever, and just, or Super One Pharmacy, and going like crazy about, oh, what did the doctor say? Do I pick this? Do I pick that? And then they're wrong stuff that they end up buying. So that's very important. So first we are going to talk about this one, the mask. So this mask is very important because, one second, I'm coming. Okay, but while I'm doing the video, I'm going to be there in just a second. Thank you. That's the real life. Okay, so we have this this mask here. This is the one with the beads and everything, the gel mask, and this is the one that I do recommend with people who have meibomian gland dysfunction. Remember, the ones where the lids have the glands that are clogged. So you wear this mask and you read the instructions, you put it in the microwave, and you know exactly how long you have to put it in the microwave. Make it warm, not hot, okay? Don't burn your eye. And then you wear it with this thing strap around your eyes, and then leave it for about maybe 2 minutes, 3 minutes, whatever the instructions say. The warmth from this gel or mask is going to open up the clogged glands, okay? It's called the vasodilation effect that comes from the warmth of this mask. So do that. Very effective from MGD, meibomian gland dysfunction, and therefore the tears are going to be better as well. So you do that. Along with that, for meibomian gland dysfunction, you use these capsules also, and it is about 90 soft gel capsules that come in it, and this is important because it has omega-3 fatty acids. For chronic meibomian gland dysfunction, you need to take this. Very, very important stuff, and this comes in this kit as well. And it also has advanced omega-3 supplement with vitamin E, so really good stuff. It's good. Omega-3 fatty acids, fish oil pills with omega-3 fatty acids are so good, not just for the eyes, but they're good for the memory, for mood, for the heart, for cholesterol. It's like amazing stuff. Highly recommend that. And then we have this OcuSoft hypochloric gel for eyelids and eyelashes. So remember the crusting that I talked about, the blepharitis, that can go inside the eyes and cause dryness as well. So you do the spray, and for this, what you do is, and all the instructions are given to our patients on this paper. It's called the dry eye treatment kit. So you read the instructions and we give that to the patients. And for this spray, we also have this little, booklet, pamphlet to go with it. So you take the spray and you spray it on one of these cotton pads from this, and then you slide it on your eyelashes, like right to left, right to left. Or just like for women, it's easy to know because we take off our eye makeup, and sometimes instead of this, I also do the lid scrubs. Actually, the OcuSoft company makes the lid scrubs, and I use it to take off my eye makeup, and it doesn't irritate my eyes because it's such good stuff, right? So you do that and takes care of that crusting. And then we have these Oasis tears, just like I talked about, the over-the-counter tears. You can use these. Very, very effective, all coming in one kit. Very, very convenient. And then iodine. So iodine deficiency can also cause dry eyes. Normally patients don't think about it, but that's why Dr. Lahi added that as well. So he's making sure that everything is covered for the dry eyes, because it's notorious. This finding is notorious. And this iodine comes with selenium, zinc, vitamin B7, and vitamin C, 90 capsules, dietary supplements. So everything comes in this bag, which is the dry eye kit bag, and we give it to our patients. So important. Now, if this is like the first line treatment, and after that we go with other treatment plans, such as a prescription drop that I give to my patients, which is known as Restasis. I can do that twice a day, or Zydra twice a day. And it depends on what insurance is covering and what is not covered. If nothing works, then the second line of treatment is punctal plugs, okay? So there's this little opening from the eyes. The tears drain through the punctal plugs, goes through the nasolacrimal duct in the nose, and then goes into the throat. That's why when you put eye drops, you can taste them in your throat. So that's what I do. I can put the punctal plugs in the office. After numbing that area, I put the plugs depending on the size of the patient's puncta, and that clogs it. It's almost like clogging effect in a sink. You clog the sink and you can do the dishes. There's more water in the sink, so therefore they have more tears tears in their eyes. Third line of treatment, if nothing works, then my third line that I recommend personally is amniotic membrane graft. This is a graft that it's a corneal graft that I use, and it comes from the human fetus, obviously. And I put that, it comes obviously, cultured, treated already, and you put that corneal graft onto the cornea. It's known as the amniotic membrane graft, and maybe someday I can show it to you how I do it in the patients. And all the good stuff, the ingredient, the nutrients, the growth factors, and everything else goes into the cornea and starts healing the cornea. So that was about dry eyes. I know this video was a little bit long because dry eyes is a big term, it's a big topic, it's a vast topic, and there's so many components associated with dry eyes. I just barely touched a little bit today. Like seriously, there's so much more to know about dry eyes. So the take-home message is always know what type of dryness you have and how it is treated. Go to your primary care, eye care provider, eye specialist in order to know what kind of dryness you have. Before I end this video, there's one term I want you to remember. It's called keratoconjunctivitis sicca. That's also important to know. That has 3 things that are associated with it: dry eyes, dry mouth, and conjunctivitis, and I treat that on a regular basis as well. So just sitting at home, you wouldn't know exactly what it is. Consult with your eye specialist. Okay, that was all about dry eyes. I'll see you guys later. Bye.